your timer and here is your question. Right, so if you've read and understood considering it history taking station, kindly begin.
Thank you, ma'am. I'll enter the room and wash my hands. Hello, good morning. I am Dr.
Good morning.
May I, one of the exam candidates, may I confirm your name and age, please?
Yeah, doctor, I am 56-year-old Smith.
Okay, that's noted. This morning I've been asked to interact with you concerning your one of your complaints. May I proceed?
Yeah, sure, doctor. Tell me.
Okay. How may I help you?
Doctor, these days I'm not feeling good actually. I have some issues with my personal life. I'm not happy with my sexual life.
Hey, sorry about that. Sorry about that. We'll get to the root of it and we'll see how we can help you. So sorry about that. For how long has this begun?
Doctor, this is happening for last almost 6 years, 6 months.
6 months.
Yeah.
Okay, that's noted. Did it begin suddenly or it was gradual?
Doctor, actually, it was suddenly, it was gradually, doctor, over a period of 6 months. Now I don't have any interest. Sometime we have our relation, but I'm not feeling good, doctor.
So sorry. I'm so sorry about how you feel. I can appreciate how you feel. Aside from what you have told me, do you have any other complaints?
No, doctor. Mainly, this is my complaint. I don't have a proper erection, doctor, to have a successful intercourse.
How about your partner? Are you able to penetrate your partner each time you meet with her? Or
Sometime yes, sometime not.
Okay. Each time you are able
Use the term
to penetrate
your partner.
Okay. Each time you're able to meet with her, are you or with your partner, are you able to have a satisfactory interaction or sexual?
Yes.
No, doctor. We don't have that. Earlier we used to have that. As of now, I want to tell you, I have 2 kids. I'm a father of 2 kids. Earlier we used to have, but now it is not happening like that, doctor.
It's so sorry about that. Have you noticed that you've lost interest in the previously pleasurable activities?
No, doctor, I have an interest. I want to do that, but I'm not able to perform it. Is it due to my age, doctor? As I'm 56-year-old?
Not particularly. People of your age can still be sexually active. We'll get to the root of what is wrong with you and be able to address that appropriately.
I'm very much concerned, doctor. I'm very sexually active, doctor.
I'm aware of your
concern. This is my second wife, doctor. I don't know, man, what is happening to me, doctor.
Okay, so sorry about that. I will still have to ask you some questions so that we'll be able to have an idea of what could be wrong, and we have to run some tests also. Can I proceed?
Yes, please proceed.
Have you had? Do you have any medical illness that you have been on treatment for by your GP?
No, doctor. I'm having an active lifestyle. I am not having any disease.
Okay. Are you on any medications that you are using regularly or you have been on for the past time?
No, doctor.
Do you have any allergies?
No, doctor.
Is there anybody in your family that has a similar complaint that you have?
No, doctor.
Okay, do you smoke?
Doctor, I earlier used to smoke. Now I left for last 2 years.
Okay, when you were smoking, how many sticks were you used to taking per day?
I will take, doctor, 6 cigarettes a day.
Per day. For how many years did you smoke?
For 10 years, doctor.
For 10 years?
Yeah.
Okay, that's noted. Do you take alcohol too?
No, doctor, I don't take alcohol.
Okay, with your wife, do you have any marital disharmony presently or anything that is bothering you within your family?
No, doctor, I have a good business. I'm earning good. I don't have that.
How about your work, sir? What do you do?
I'm a businessman, doctor.
Okay, any challenges, anything making you unhappy at your workplace?
No, doctor, it is a day-to-day life, the challenges of day-to-day life. Otherwise, it's not a big, major challenge.
Okay, have you had any surgery in the past, especially in your lower abdomen, your lower tummy?
Yeah, doctor, I underwent a surgery for hernia 6 years back.
Okay, 6 years back. That's noted. Do you have any idea of what could be responsible for your complaints?
I thought it is due to my age, doctor.
Sorry, I didn't get that.
I thought it might be due to my age, doctor.
Okay, do you have any expectation from us? Anything you feel will be likely good for you?
Yeah, doctor, I want that I have a very good sexual life. I want you to cure me about this problem. I want my sexual life back.
Yes, that's a significant expectation, and we will try our best. After finding out the cause for what is responsible, then we'll discuss our findings with you, and we'll likely investigate you, and we'll treat you in that regard. Thank you so much for your time. I appreciate it.
Present your history now, please.
If time would have permitted me, I would have take a detailed review of other systems. In summary, I've interacted with a 56-year-old father of 2 who complained of a 6 months history of inability to achieve sexual interaction, which has had a significant strain on his private life with his second wife. He has 10 years history of a significant smoking and has undergone angiography.
So what are your differential diagnoses for this patient?
My differential diagnosis include erectile dysfunction. He may also have depression. It could also be secondary to psychological conditions as a result of the erectile dysfunction that he has. He may also have hypogonadism.
Okay, and BPH maybe as well. Okay, what investigations would you ask for to confirm your diagnosis?
I would like to do a hormone profile, full blood counts. I'll do random blood sugar with 2 hours postprandial and glycated hemoglobin. I will do a C-reactive protein fat and lipid profile, liver function test, electrolyte urea and creatinine. Imaging, I will do a scrotal ultrasound. I could do a duplex ultrasound. I could do a transrectal ultrasound and a penile and arterial angiogram.
Okay, what are the treatment options that you can offer?
The treatment options include the psychosocial and sexual counseling for both my patient and the partner. And yes, I could also introduce medications after this to also support this. Phosphodiesterase 5 inhibitors could be used. Examples include tadalafil and the likes. I could also intracorporeal injection of aprostadil, and the patient could also benefit from, if all of these fail, you can benefit from penile prosthesis. It can be inflatable and non-inflatable. It can also be rigid and semi-rigid, and cuffed, non-cuffed, and some of them could be 3-piece, and some of them could be 2-piece. Thank you, ma'am.
Good. Thank you so much. Some of the questions that you could have asked for the presenting complaint, you didn't. Did you ask about the family history? And I don't think any drug allergies. That part was also missed. Okay, some of the questions that how worse is the problem? Yes, Dr. Abdulaziz, you raised hand.
Okay, I have few comments. I don't know if you are
Yes.
true. Yes. I'm not sure if it's important to get a chaperone at this station. In some notes,
Yes, it is important. I forgot.
Yes, it is. It is because it's very personal.
Thank you. Thank
And
you.
in the thank you. Yes, it was. I
yes,
was
then
coming there.
also the
Yes.
erection. There are
Yes.
some places that you give a score, maybe 0 to 100.
You
How-
0 to 100. Yes.
How will you rate it?
And how bad the situation is? Is it getting worse or is it stable since last 6 months? And if there was any nocturnal or early morning,
Nocturnal, morning
yes,
erection,
yes,
penile
These-
curvature,
curvature, yes.
performance anxiety, appetite.
He did ask if there was performance anxiety, feelings of performance anxiety, because the patient said it's second wife. So maybe the first one left because of the same reason. Now the second one, now it's causing or giving the anxiety. So there could be factors.
Thank you.
Good. Yes, chaperone. Very good, Dr. Abdulaziz. Yes.
One more thing, Dr. Tule, you have to start like this all conversation will be confidential, and
Yes,
this I think
reassurance.
this point should be must actually. The confidential word should I think should be given
Should be.
due importance.
Yes.
Thank you. Thank you.
Yes.
Thank you.
Yes, yeah. Then only patient will speak up. Otherwise, like no matter how old it is, male patients don't like to talk about it. So if until unless you will reassure, okay, it will be between you and the patient, and it will be like